Okay, so we're diving deep into mood disorders today. You've given us Unit 1 mooddisorders.pdf and this YouTube video, Living Through Depression, Julia's Story.
Wow. Sounds like someone wants to really get a handle on this, not
Um,
just, a surface level understanding.
right. Like they
Yeah,
want the nuances, the real lived experience of mood disorders.
exactly.
And we're going to give it to them. Before we really get into the different diagnoses like depression or bipolar, there's this thing the source material kept mentioning, and I have to admit it kind of threw me.
How?
They differentiate between mood and affect, and honestly, I'd always thought they were basically the same thing.
I can see why you'd think that. A lot of people use those terms interchangeably, but in this context, they have distinct meanings. It's an important distinction when we're talking about diagnosis and treatment.
So how do we tell them apart then?
Well, you can think of affect as what you see on the surface. It's the immediate expression of emotion. So someone's facial expressions, their tone of voice,
Hmm.
those outward signs of how they're feeling right now, that's their affect.
Okay, so that's the outward stuff. Then what's mood?
Mood is more like the climate, I guess you could say.
Yeah.
It's the underlying, more sustained emotional state. And importantly, it's what the patient reports feeling internally. It's not always visible to others.
So like if someone's putting on a brave face, but inside they're feeling super anxious or depressed.
Exactly. So for a proper diagnosis, we can't just rely on outward behavior. We have to listen to how the person describes their internal experience, their mood.
Got it. That makes sense. And I guess it's especially important when we're talking about kids, right? Because they might not always have the words to express how they're feeling, or they might act out in ways that don't necessarily reflect their true mood.
Absolutely. And that actually brings us to one of the things you sent over, DMDD.
Disruptive mood dysregulation disorder.
Yeah, that one. This is a diagnosis that can be tough to pin down, especially in kids and teens.
Yeah, from what I read in the material you sent, it's not just a case of kids being moody or having a bad day. It sounds pretty intense.
It is. We're talking about severe and recurrent temper outbursts that are way out of proportion to whatever triggered them. And these outbursts happen like 3 or more times a week. And it's not just the outbursts, it's this chronic underlying irritability too. Like they're just constantly on edge, easily frustrated.
Yeah, that definitely sounds like a lot more than just typical childhood tantrums.
Right, and the source material actually goes out of its way to say that DMDD is not the same as other childhood disorders like oppositional defiant disorder or intermittent explosive disorder.
So what's the key difference then?
The key with DMDD is the persistent irritability. These kids aren't just having outbursts in response to specific situations. It's like there's this constant simmering anger underneath the surface.
Wow. So what can be done to help these kids and their families?
Well, that's where it gets even trickier. There aren't any medications specifically approved for DMDD, so treatment often involves a combination of therapy, like cognitive behavioral therapy, and sometimes medication to manage the symptoms.
So it's more about helping them cope with the symptoms rather than finding a cure, so to speak.
Unfortunately, yes,
Mhm.
at least for now. But research is ongoing, and hopefully we'll have more targeted treatment options in the future.
I hope so. Now let's move on to depressive disorders. Our source material lists several types, but one that I think deserves more attention is PMDD, premenstrual dysphoric disorder.
Absolutely. It's a condition that's often misunderstood and dismissed as just bad PMS, but it can be so much more debilitating than that.
Right, and that's where Julia's story in the YouTube video really hit home for me. She doesn't explicitly mention PMDD, but she does talk about the weeks leading up to her period as a time of intense emotional turmoil, even more so than during her depressive episodes.
It's definitely something to consider, especially since the symptoms of PMDD can be quite severe: mood swings, irritability, anxiety, even physical symptoms like bloating and headaches.
And it's not just about physical discomfort, it's the emotional piece that can be really overwhelming. The source material talks about how PMDD can significantly impact relationships, work, every aspect of a person's life.
It's not something to just brush off, that's for sure.
The source material also highlights the importance of looking at the whole person when diagnosing depression. It's not always a standalone issue, is it?
You're absolutely right. Depression can sometimes be a symptom of another underlying medical condition.
So we shouldn't just assume it's primary mental health issue. There could be something else going on.
Right. We have to rule out things like thyroid disorders, hormonal imbalances, chronic pain, even certain medications. A thorough medical history is crucial.
That makes sense. So let's talk about what many consider the most classic version of depression. major depressive disorder, or MDD.
This is where Julia's story in that YouTube video is so powerful. It really puts a human face on this diagnosis, you know? She doesn't sugarcoat it. She describes those feelings of utter despair, the hopelessness, the exhaustion.
Yeah.
It's heart-wrenching, but it also helps us move beyond the clinical definitions and understand the real lived experience of MDD.
And it's not just about feeling sad, right? It's much deeper and more complex than that. The source material outlines specific criteria for MDD, like you need to have at least 5 out of 9 symptoms for over 2 weeks.
Exactly. And those symptoms can be really varied, like changes in sleep, appetite, energy levels, concentration, and even thoughts of death or suicide. It's not just a bad mood, it's a serious condition that can significantly impact a person's ability to function.
And it's not always clear what causes it, right? The source material talks about genetics, neurotransmitters, life events, and how it's often a combination of factors.
Yeah, it's rarely a simple answer. It seems like there's often this perfect storm of vulnerabilities and triggers that lead to MDD. There might be a genetic predisposition, but then stressful life events or even just individual personality traits can make someone more susceptible.
It's like all these pieces coming together.
And even though millions of people are affected by MDD, it still feels like there's so much we don't know about it.
And that makes it even more important to keep researching and learning so we can better understand this complex disorder.
Absolutely. Every new piece of information brings us closer to finding more effective treatments and better ways to support those who are struggling with MDD. And that's what makes finding the right treatment so important. You know, it's not one size fits all.
Right. So let's talk about the different treatment options for MDD. Our source material had a whole section on medications, and I gotta say, all those acronyms, SSRIs, SNRIs, it can get pretty confusing.
I hear you. It's a whole alphabet soup of medications out there.
Can you help us break it down a bit? Like, what are these medications and how do they actually work?
Of course. But first, we need to back up a little and revisit those neurotransmitters we were talking about earlier. Remember serotonin and dopamine?
Yeah, those chemical messengers in the brain that are linked to mood and all sorts of other things.
Right. Well, many of the medications used to treat MDD work by targeting these neurotransmitters.
Okay, so how does that work?
So one of the most common types of antidepressants is called SSRIs, which stands for selective serotonin reuptake inhibitors.
SSRIs, okay. And what do they do?
They basically increase the levels of serotonin in the brain. See, normally, serotonin is released by one neuron and then taken back up, or reuptaken by that same neuron. But SSRIs block that reuptake process, which means more serotonin is available in the brain to do its job.
So it's like boosting the brain's supply of feel-good chemicals.
That's a good way to put it. And that increase in serotonin can help improve mood, sleep, appetite, and other symptoms of depression. One of the most well-known SSRIs is fluoxetine, but you might know it better by its brand name, Prozac.
Oh yeah, Prozac. I've definitely heard of that one.
It's been around for a long time and has helped a lot of people. But sometimes SSRIs aren't enough on their own.
So what happens then? Are there other options?
There are. Another class of antidepressants is called SNRIs, which stands for serotonin norepinephrine reuptake inhibitors.
SNRIs. Okay, so what's the difference between SNRIs and SSRIs?
Well, as the name suggests, SNRIs target both serotonin and norepinephrine. Norepinephrine is another neurotransmitter that plays a role in mood, but it's also involved in things like alertness and energy levels.
So SNRIs might be a good option for people who are experiencing fatigue along with their depression.
Exactly. One example of an SNRI is duloxetine, which is often marketed as Cymbalta.
Cymbalta, okay, I've heard of that one too.
It's actually often prescribed for people who have both depression and chronic pain, since norepinephrine is also involved in pain signaling.
Interesting. So it sounds like finding the right medication can be a bit of a process, right? Like trial and error, working closely with a doctor to figure out what works best for each individual.
It definitely is. And it's important to remember that medication isn't a magic bullet. It takes time to work.
So you're not going to feel better overnight.
No, unfortunately not. It can take weeks, sometimes even months, to find the right medication and the right dosage. And sometimes medication alone isn't enough.
Which is where therapy comes in.
Right. Psychotherapy can be a really valuable part of treatment for MDD, whether it's used alongside medication or on its own. One of the most common types of therapy used for depression is cognitive behavioral therapy, or CBT.
CBT, okay. What's that all about?
Well, the basic idea behind CBT is that our thoughts, feelings, and behaviors are all interconnected. So if you can change the way you think about things, you can change the way you feel and behave.
So it's about recognizing those negative thought patterns and learning how to challenge them.
Exactly. And it's not just about thinking positive, it's about learning how to think more realistically and constructively. CBT can also help people develop coping skills for managing stress and difficult emotions.
That sounds really helpful.
It can be. And our source material also mentions interpersonal therapy, or IPT, as another effective form of therapy for depression.
IPT, okay. How is that different from CBT?
IPT focuses more on the role of relationships in depression. It's based on the idea that our relationships can both contribute to and help us recover from depression.
So it's about understanding how our interactions with others affect our mood and learning how to build healthier relationships.
That's a big part of it. It can also help people work through grief, conflict, or other relationship issues that might be contributing to their depression.
I can see how that could be really beneficial. So we've talked about medication and therapy. Are there any other treatment options for MDD?
There are. Our source material briefly mentioned ECT, or electroconvulsive therapy, as an option for severe cases of depression.
ECT. Yeah, that's the one where they send electric currents through the brain, right?
That's right. It sounds a little scary, I know, but it's actually a very safe and effective treatment for people with severe depression who haven't responded to other treatments.
So how does it work?
Well, basically, the patient is given anesthesia and muscle relaxants, and then a brief electrical current is passed through the brain, which induces a controlled seizure. Now, we don't fully understand why, but this seizure activity seems to reset brain chemistry in a way that can alleviate depression symptoms.
Wow, that's fascinating. And a little bit mind-blowing, to be honest.
It is. It's a pretty intense treatment, so it's usually reserved for cases where other options haven't worked, but for some people, it can be truly life-changing.
Sounds like it. So we've covered a lot of ground here with depression, but Julia's story actually hints at something else we need to talk about, bipolar disorder. Remember how she mentioned periods of intense energy and impulsivity?
I do. That's a classic sign of mania, which is one of the hallmarks of bipolar disorder.
Right. So let's shift gears and talk about bipolar disorder. What exactly is it, and how is it different from depression?
Well, the defining feature of bipolar disorder is the presence of these extreme mood swings between depression and mania. It's like riding a roller coaster. You have these periods of intense highs followed by crushing lows, and the highs aren't just feeling happy or energetic, it's much more intense than that.
So what does mania actually look like?
Well, during a manic episode, someone might feel euphoric, like they're on top of the world, but they can also be really irritable and agitated. Their thoughts might be racing, they might have trouble sleeping, they might be talking a mile a minute, and they might engage in risky or impulsive behavior.
So it sounds like it can be pretty disruptive to their life and potentially dangerous, too.
It definitely can be. And it's important to distinguish between bipolar 1 and bipolar 2 because the severity of the manic episodes can vary.
Okay, so what's the difference?
In bipolar 1, the manic episodes are more severe and can last for a week or more.
And that often leads to hospitalization.
Often, yes, because the person might be so out of touch with reality that they need intensive treatment to stabilize their mood.
And what about bipolar 2?
Bipolar 2 involves hypomania, which is a less severe form of mania. The symptoms are similar, but they're not as intense and they don't last as long.
So it's basically a milder form of bipolar disorder.
Not necessarily. While the manic episodes might not be as extreme, the depressive episodes in bipolar 2 can be just as severe as those in bipolar 1.
Oh, I see. So it's not that bipolar 2 is milder overall, it's just that the manic episodes are less intense.
Exactly. And even though hypomania might not seem as disruptive as full-blown mania, it can still have a significant impact on a person's life, leading to problems with relationships, work, and overall functioning. It's important to take it seriously and seek treatment.
That makes sense. So just like with depression, there are rating scales used to assess the severity of mania.
Yep, one commonly used scale is the Young Mania Rating Scale, or YMRS for short.
So it's like a thermometer for mania, so to speak.
Pretty much. It helps clinicians assess the severity of symptoms and track changes over time, which is important for making treatment decisions.
Makes sense. So what about treatment for bipolar disorder? What are the options?
Well, the goal of treatment for bipolar disorder is to stabilize mood swings and prevent both manic and depressive episodes. And just like with depression, it often involves a combination of medication and therapy.
So finding that balance is key.
Absolutely. And one of the most effective medications for bipolar disorder is lithium.
Lithium. Okay, I've heard of that one.
It's been used for decades, and it's still considered a first-line treatment for bipolar disorder. It's a mood stabilizer, which means it helps dampen those extreme highs and lows.
The source material mentions something about lithium toxicity, though. Is that something to be concerned about?
It is. Lithium has a narrow therapeutic window, which means the difference between an effective dose and a toxic dose is pretty small. So it's really important to monitor lithium levels closely with regular blood tests.
So people taking lithium need to be under close medical supervision.
Yes, definitely. And they need to be aware of the potential side effects and signs of toxicity, which can include nausea, tremors, confusion, and even seizures in severe cases. But with careful monitoring and management, lithium can be a very effective treatment for bipolar disorder.
It sounds like it. And what about other medications? Are there alternatives to lithium?
There are. Other mood stabilizers include valproic acid, lamotrigine, and carbamazepine. These medications work in slightly different ways, but they all aim to stabilize mood and prevent those extreme swings.
So it's about finding the medication that works best for each individual, just like with depression.
Right. And sometimes antipsychotic medications are also used, especially during a manic episode, to help reduce agitation and psychosis.
And therapy is also important, right?
Absolutely. Therapy can help people with bipolar disorder learn coping skills for managing their symptoms, identify triggers, and develop strategies for preventing relapse.
Oh, it's a multi-pronged approach.
It is. And it's important to remember that bipolar disorder is a chronic condition, which means it requires long-term management.
So treatment might be lifelong.
For many people, yes. But that doesn't mean they can't live full and meaningful lives. With the right treatment and support, people with bipolar disorder can manage their symptoms and achieve their goals.
That's good to hear. Now, before we move on, the source material mentioned another type of bipolar disorder, cyclothymia. What can you tell us about that?
Cyclothymia is sometimes described as a milder form of bipolar disorder, but again, it's important not to downplay its impact.
So how is it different from bipolar I and II?
People with cyclothymia experience hypomanic symptoms and depressive symptoms that cycle back and forth, but they don't meet the full criteria for a hypomanic episode or a major depressive episode. So the highs and lows aren't as extreme, but they're still disruptive.
So it's like a less intense but more chronic form of bipolar disorder?
That's a good way to think about it. It's like constantly riding those smaller waves of mood swings, but those waves can still knock you off balance.
That makes sense. So it's still important to seek treatment for cyclothymia.
Definitely. Early intervention can help prevent the development of full-blown bipolar disorder and improve overall quality of life.
Wow, so we've really covered a lot of ground here. I mean, different types of mood disorders, the diagnostic criteria, treatment options. It's a lot to process. But honestly, the thing that's sticking with me the most is Julia's story, from that YouTube video you sent over.
Oh, absolutely. Her story really brings it all to life, doesn't it? It's one thing to talk about the clinical definitions, but hearing someone so openly and honestly share their personal experience, well, it just adds this whole other layer of understanding.
Right. Like you can read all the textbooks in the world, but it's those real life stories that really drive it home. You know, the impact these disorders have on people's lives,
Yeah.
and not just on the person with the disorder, but on their families and friends too.
Exactly. And I think Julia's willingness to be so vulnerable also helps to chip away at the stigma surrounding mental health. Like people are still so afraid to talk about it, to admit that they're struggling.
Yeah, it's like this big taboo subject that no one wants to touch, and that silence just makes it harder for people to reach out for help when they need it.
Exactly. And that's the thing. Early intervention is so important with mood disorders. The sooner someone gets the help they need, the better their chances of recovery. But stigma keeps so many people from seeking help. It's heartbreaking.
So how do we break down that stigma? It feels like such a deeply ingrained societal problem.
Well, I think it starts with education and open conversations, like we're having right now.
Mm.
We need to normalize talking about mental health, just like we talk about physical health.
Right. It shouldn't be this hush-hush topic that everyone avoids.
Exactly. And we need to challenge those outdated misconceptions and stereotypes about mental illness.
Like the idea that people with mood disorders are somehow weak or flawed.
Right. Or that they should just be able to snap out of it. These are medical conditions, just like heart disease or diabetes, and they deserve to be treated with the same level of compassion and understanding.
Absolutely. And that's where resources and support systems come in. People need to know that they're not alone in this, that there are people who care and want to help.
100%. There are so many amazing organizations out there that provide support, information, and resources for people with mood disorders and their loved ones, like the National Alliance on Mental Illness, NAMI, or the Depression and Bipolar Support Alliance, DBSA. And there are tons of online communities and support groups where people can connect with others who understand what they're going through.
It's about creating a sense of community, a place where people feel safe and supported.
Absolutely. And that can make all the difference in the world for someone who's struggling. It gives them hope, knowing that they're not alone and that recovery is possible.
Well, I think we've definitely accomplished our goal of going beyond the basics today. We've covered so much ground from the science to the personal stories, and it's clear that mood disorders are complex, multifaceted, and often misunderstood.
But treatable, that's the important message here. With the right treatment and support, people can manage their symptoms and live full and meaningful lives.
Absolutely. And if our deep dive today sparked your curiosity or maybe even resonated with you on a personal level, don't hesitate to seek out more information and support. There are tons of great resources available online and in your community.
And remember, you're not alone on this journey. Reach out, connect with others, and know that there is hope, always.
Couldn't have said it better myself. Thanks for joining us on this deep dive, everyone. We'll see you next time.